So COPD means, or stands for chronic obstructive pulmonary disease. And so think of the lungs basically as a bunch of airways connected to air sacs. And with COPD, the airways, the bronchial tubes, are affected as a consequence of usually tobacco. So over 90% of COPD is related to tobacco. COPD is one of the leading causes of death in the United States. About 400,000 people a year die as a consequence of their COPD problems. The management of COPD is basically avoiding risk factors. Major risk factor is tobacco. So the issue with COPD and the issue with loss of lung function is that you have a very large lung reserve. And the problem is that most patients, unless they're physically active, don't notice that they've lost their lung reserve until it gets to be really bad. So you can lose as much as half of your lung function and still get around and do day-to-day activities. So it's an issue of basically by the time people understand or notice that they're having problems, they've already lost a significant amount of lung function. And that loss of lung function is stuff, once it's happened, we can't get it back. With regards to tobacco, the sooner you can quit, the better. So there are studies that show that even patients that have advanced chronic lung disease, if they quit, their survival is improved. And so those patients need to be quitting tobacco. That's going to be the primary risk factor. And so smoking cessation would be something that you need to discuss with your doctor. And that's going to be an effective therapy for preventing problems in the future, not just related to chronic lung disease, but to heart disease, stroke, hypertension, all kinds of other illnesses, and other cancers besides lung cancer, because those cancers are often associated with chronic tobacco exposure as well.